when I was presented with the idea of using the same locator for a fixed restoration, it just blew my mind. It's something that it should have been done years ago. Dentistry needed this. And I think this is this is just the beginning of, I think, a wonderful journey or second coming of such a disruptive technology as locator was 21 or so years ago to just a new era of being able to provide very similar restorations with much better outcomes, utilizing the same hardware and the same techniques as we have for well over 20 years. What LOCATOR FIXED is going to do is it's going to allow the general practitioner that can take an alginate impression and can do a teeth try-in to be able to deliver fixed full arch restorations in 4 to 5 visits without any of these convoluted processes. So I think the way that LOCATOR FIXED is going to revolutionize the fixed full arch procedures, it's not by adding things. It's by going back to the simplest way of delivering a full arch restoration, which is a denture, but then transforming it into a fixed with about a 15-minute procedure. And I think that's awesome. I think it's breathtaking, and I think it's going to change the way we look at full arch rehabilitations forever. It's crazy how sometimes we grow more as people when we deliver these cases than the benefit that we can give these patients. It's amazing. If you really introspect what you do for people and grow and learn from it, how much you get from it, it's just fabulous.